Hello, my name is Jerome Cornette. I'm a maternal and fetal medicine specialist from the Netherlands in Rotterdam, and I'm here to present you a very new, interesting feature in fetal scanning and fetal ultrasound, being Graphicflow. Graphicflow is a combination of color Doppler and blood speckle imaging. Because of the blood speckle imaging, it is less angle dependent and you obtain higher temporal resolution. So it permits you to see high velocities and low velocities at the same time with a lot of clarity. We have a research project on fetuses with congenital heart disease, fetuses with growth restriction and normal fetuses, and there we look at myocardial function and hemodynamics of flow. I think Graphicflow can give us a lot of new insights on how fetal heart works. Here you see that you have a very nice and clear image at normal fetal heart rates, but you can push the slow motion button, and then for 3 seconds you will see that the image just reduces in flow, and you can really much more easy follow the blood speckles going through the ventricles and the large vessels. But that also permitted us to see some cardiac defects that were not visible with conventional color flow, especially in fetuses with VSDs and fetuses with arch abnormalities. We think that this technique might have an added value. I think this new technology is really innovative. The blood speckle imaging permits you to see blood flow that was previously much more difficult to see because it's less angle dependent. And I think for several cardiac abnormalities like arch problems and VSDs, it really has an added value. That's our first experience with it, and we hope to prove this in further studies. I think there are a few other things, other issues that are still not resolved yet in fetal cardiology. For example, predicting coarctations, or eventually to predict which fetuses will need balloon septostomy in the first days after birth, after transposition of the great arteries or hypoplastic left hearts. We're not there yet with our conventional methods, and with the new insights we could eventually obtain about hemodynamics and blood flow that we can observe with Graphicflow, we hope to find better ways to predict which fetuses will have a more difficult outcome.